Hi, welcome to Your Health Matters. I'm Scott Kern. You know, living in rural Arizona, people don't think that we have the technology that we do here at Kingman Regional Medical Center. Today, we're going to talk about the newest technology that we have, and it's going to impress you. The partnerships we formed through the country with these new programs are fantastic, and I cannot wait to talk to you today about what we have here at Kingman Regional Medical Center and how it can help your health. So stick around, we'll be right back. It's going to be a great show today. Hi, welcome back to Your Health Matters. I'm Scott Kern. Today we've got a great guest from Kingman Regional Medical Center. We have Reddy, the director of our cardiovascular cath lab. Right?
That's right.
Right. Welcome, Bhratta. Tell me about yourself. What's your background in education?
To start with, I'm not just over the cath lab. I'm also over all critical care services and the cardiovascular services.
Okay, so when you say critical care services, what does that entail?
So I'm over the cath lab, the echo department, which does a lot of the cardiac stuff. I'm also over the intensive care unit, and we also have a specialized cardiovascular intensive care unit. In other words, that's an open heart unit. That's where patients who have had open heart surgery go to.
Okay.
That's also an intensive care unit, but it's specialized.
Okay.
So I'm over that, and I'm also over the step-down unit. That's the unit that once a patient gets a little more stable in the intensive care unit, they're doing a little better, but we still want to keep a closer eye on them, then we transfer them to a step-down unit.
Okay, so let's start with the cath lab and talk about that a little bit. The cardiovascular lab, excuse me, or the cath lab is what we call it here in the hospital. Tell me about that. Why would someone go to the cath lab?
Anybody with a cardiac condition. Also, anybody who's had a vascular issue could end up in the cath lab. What I mean by vascular issue is you often find that a lot of patients, especially in our areas, have problems with their circulation in their arms or legs. They get extreme pain when they walk, or some of them are actually unable to use their legs to walk. So whenever there's circulation problems in the arms or legs, that's peripheral vascular structures. So we have doctors who actually treat that also in the cath lab. So we can do both cardiac stuff, which is you have a block in your heart or in your vessels, you had a heart attack, or you come into the ER and you're having an active heart attack, we rush you to the cardiac cath lab, try and open up those blood vessels.
So how do you open up the blood vessels? Is that using a stent?
Yes, there are many devices we use. The older devices, like balloons, are still used occasionally. We put stents in. Stents is a little metal clip that basically goes into the vessel and then keeps it open. And there are different kinds of stents. The newer ones can actually have medication also. So when it opens up, it is also putting out medication to treat the clot.
Oh.
And then, of course, we have other devices such as little machines that can actually cut some of that blockages. So these are the devices. Stents are the most common. We use balloons.
So before we go forward, let's talk about stents real quick. When someone has a stent put in, what's the procedure for that? I mean, how do they insert it into the body to get it up through there? I've heard different accounts of how it happens. I don't have one, and I'd like to never have to have one, but just in case I do, walk me through that process.
Okay. So if your cardiologist tells you that you have a blockage and he would like to open it up to help you, or if you came in the ER and you're actively having a heart attack and we need to do it urgently, either way, you'll end up in the cath lab. If you're coming in from your house for an appointment to get this done, you come in for front desk, we register you in, we take you to a little bed. We actually have a very neat system, I think, that a lot of cath labs do not. If you're scheduled, and it's not an emergency, we actually invite you to come visit the cath lab. You get to see our staff. You get to see where you'll be. You'll get to see where you come back after the cath. So you see the entire premises and what you'll be going through on the day that you have your cath beforehand. We also educate you about what to expect, what happens, what are we going to do, and so forth.
Wow.
So then the patients feel really comfortable because they've been through this whole thing. They've seen the spot. They've actually met the nurses.
So it's pretty encompassing.
Yes, and we show them a video. So then on the day they come, they follow the same routine. It's familiar to them. And then we put them in a bed. We prep them. And it's actually an extremely simple procedure, and thousands are done across the country every day. Normally, there are two ways that the cardiologist can reach the heart. One is through the groin. So it's much like inserting a big IV. The patient is not put to sleep. There's just some numbing medication given so the patient doesn't feel anything, but they're fully awake. And then the cardiologist puts in a line, like a big IV line, into the groin and inserts a wire that then goes all the way up and into the heart.
Wow.
And then they can insert some dye to see where the blockages are. They can put the stent through that same access, yes. Or they can balloon it. So that's how it is. And actually, while the patient's lying down, the physician and the staff is talking to them. If they want to, they can see the pictures of their heart. And then post-procedure, when they come out, the doctor will come, show them their pictures, explain all this to them, explain where the blockages are.
So it's pretty encompassing from start to finish. Before you have your procedure set, if you get to schedule the procedure, it's not an emergency case. You can come in beforehand.
Right.
You'll walk through, meet the staff,
Right.
which is cool. They're great ladies in there. The nurses in the cath lab are fantastic, and all the techs are amazing. You guys just had your open house for February Heart Month.
Yes.
And it's really neat to see all the different technology that you guys are using in these programs. So you come in, you meet them, they walk you through everything, and they just make the patient comfortable with the process. So it's relatively no fear.
And we have some big advantages. Like I said, our education and orientation of the patients is a huge plus. The other big difference is we have very experienced staff, which I know a lot of hospitals struggle with. Debbie Singer, who's our supervisor for the cath lab, has been here 13 years. You know a lot of the nurses yourself. There's Judy Gauthier, who's been here for 14 years. There's Claire Crum, who was there with us recently until she retired, and that I think she was over there for 30 years. But very solid staff with lots of good experience.
So how did you get involved with this? I mean, what path of education did you take, and what's been your journey to KRMC to get to overseeing the cath lab and our critical care services?
Okay, good question. Education-wise, I have a couple of masters and a couple of bachelors. I'm a nurse practitioner who's family board certified, but I've practiced in heart failure and transplant, so mostly cardiology kind of background. After having done worked as a nurse practitioner, I also have an MBA. So I transitioned to working in administration to basically set up or run units for hospitals.
Wow.
So initially I used to be director for critical care, trauma, those kind of things. Later, I switched over to being a consultant. So as a consultant, I used to work with any hospital that needs help. So I worked all over the country, all kinds of hospitals and all types of hospitals, sizes also. And basically, I could do anything that they need done. Often they'll call me in to open up a new heart program or set up an EICU. One hospital wanted me to raise their patient satisfaction scores. So all kinds of different work.
So you've run the entire gamut of healthcare,
more
so
or
to
less.
speak. You've helped set up programs. You've returned programs from low patient scores to higher patient scores. And
Right.
I'm stuck on the fact you've got 2 master's degrees and 2 bachelor degrees. I had a hard enough time getting my first bachelor's degree, and I don't want to go back for another one. So that's pretty impressive.
Yeah, I have 2 masters and a postmaster, so it's technically 3. But
Oh,
Yeah,
that's
so.
3. I'm sorry. When you have that kind of number of degrees, you want to make sure you get those right. I can appreciate that. So you've been here for about 3 years then,
Yes.
and you started initially up in the intensive care unit, or?
Yes. Initially, they called me in to help with the open heart unit, the cardiovascular intensive care unit. Then they asked me to take over the cath lab and echo, and then they told me they wanted me to keep the cardiac cath lab and echo, but also take over the ICUs and the PCU. So that's how I ended up with being over those units.
Well, that's pretty. That's very impressive, and that's cool to see. You know how much you've been able to help bring KRMC along with our heart program over the past few years. I know we've gone through some heart surgeons, cardiothoracic surgeons. We've got a great one with Dr. Asher, who's helping reestablish us in that field, and I know he's done a lot of great work with the cath lab and the echo department too. Now, what exactly is the echo department for anyone that hasn't had to go through the echo process?
So echo is the department that deals with imaging. And we use echoes for a lot of things to diagnose what's going on. And it's a very crucial piece. It is a really cool technology because it doesn't involve hurting the patient in the sense we don't insert anything into the patient. It's non-invasive.
Okay.
We just put some gel on top of the patient. We have a probe. We run it over the gel. And then we can see inside the patient as to how the heart is actually moving. We get a moving image of the heart. It's like a video. So you actually can visualize and see how the heart is moving. Is it flabby? Is one portion of the heart affected? Is there a problem? You know, what are the valves? So it's very cool technology. It has come a long way. And in fact, one of the fastest growing areas in technology now is imaging.
So, you know, at the top of the show, we mentioned that we have a lot of great and state-of-the-art technology here at the hospital. Can you tell us about some of that? Like you said, we got great technology in the echo lab, and even going back to the cath lab for a second. What is some of the newest technology that will make someone want to come to Kingman and KRMC for their health?
For example, when I told you we do several things, right? We do vascular procedures, we do cardiac procedures, we have an open heart program, we have a thoracic surgeon, Dr. Brace, Dr. Asher is our open heart surgeon. So all these different programs, and thankfully, administration has been great in making sure we have the latest technology to provide to our patients. So one example would be we have the ICE machine, and it's not what you think. It's not the ice you put in your glass. It's ICE, ICE, intracardiac echography. So it's a cool device that is pretty advanced that we use inside the cath lab that can actually take these moving images of the heart from inside the body. So that's like the latest piece of technology. A lot of people don't have it. We have it. All our equipment in echocardiography, they're state-of-the-art GE equipment. That's the latest model, latest software. So I really couldn't ask for any better support.
Absolutely.
And really, anybody in our community who comes to our hospital has the advantage that we are able to use these latest technology for their benefit.
Absolutely. That's really neat. Yeah, go ahead. Sorry.
Yeah, I could give you an example. Here's something that's a device that is used to record the how your heart is functioning, the heart rate and the rhythm of the heart. This is something that is implanted into the patient, and as you can see on this side, the bigger one is what is the older model, and we've just got this newer model here on my the little one. As you can see, this is a huge difference.
That's a tremendous size difference.
Right, and just in fact, this week we put one of these in, the smaller ones. So I'm very pleased that the hospital gives us this latest technology to provide to our patients who come here.
Absolutely. You know, I'm glad you brought that up. I've got a lot more questions about that, but we've got to cut to a commercial break. So when we come back from the commercial break, I do want to talk to you about these items in particular and see what else we can find out about the cardiovascular units here at KRMC. So stick around. We'll be right back after these messages.
What does that tell somebody like me who's looking from the outside?
Hi, welcome back to Your Health Matters. I'm Scott Kern. We're talking with Reddy, the director of our cath lab and our critical care services here at KRMC. And Bhratta, we've been talking about a lot of the technology that our cath lab and our echo lab has and is using for our community to make sure that they have the best health care possible. Now, on top of that, we also have a program that we started in November called the Open Heart Program.
That's right.
So tell me a little bit about that.
So, as you mentioned, we have an open heart program, and we have surgeries every week that we do for open heart surgeries. We're very fortunate in the fact that we were able to get Dr. Alan Asher, who is an extremely experienced and seasoned surgeon, well trained. In fact, a lot of our physicians here have known him when they were training.
Oh, really?
So he's very well respected in his field. He's from the East Coast. He's worked in Mount Sinai and other hospitals that are, kind of brand name hospitals. So we're very fortunate that he agreed to come and join us. And so he's our main surgeon who does the open heart surgeries. The team consists of Dr. Jeff Lunn, who's the cardiac anesthesiologist, the main one. There we have Dr. Nader, who's also there. And we have Addie Bonds, who's the PA. So that's the crux of the team. To give you an example of what caliber of people these are, every patient that undergoes an open heart surgery or is referred to them, they make sure that they manage that patient right from start to their discharge. And that may not say much, but here's an example of what I mean. Just day before yesterday, one of our patients went to Bullhead and needed a prescription. Dr. Lunn actually drove from Kingman to Bullhead and gave her a prescription and made sure she's got what she needs.
Wow.
To me, that is what I mean by these are excellent people. These are the kind of people that you and I would love to have as our physicians.
Absolutely.
So to me, that is the proof of the pudding is, would you want this kind of physician? And the answer is clearly yes. I would love to have all my physicians like that.
Absolutely.
So that's where we are with that. So they're extremely experienced. We have a very good team in the cardiovascular intensive care unit where these patients come. And those nurses have been doing this for for quite a few years now. So they're very experienced, and the care is extremely good.
Okay.
And we have great feedback from the patients.
So we have the open heart program. There's also a thoracic program that you oversee too, right?
Yes.
Now explain that a little bit.
So open heart program, as it mentions, the surgeon works on the heart. We also have, of course, that Dr. Asher is a multi-talented surgeon. He's capable of doing hearts, he's capable of doing thoracic, he's capable of doing vascular. So he is, like I said, an excellent example of reaching the top of your profession. Now, in addition to Dr. Asher, we also have people like Dr. Braze, who's is a specialist in thoracic surgery. So if people have cancer, they need part of their lung removed or any lung surgery, Dr. Braze does those. So the other advantage we have is not only do we have Dr. Braze, who is specialized in thoracic surgery, not only do we have Dr. Asher, who does all of this, we also have vascular procedures that we cover. Almost any kind of vascular procedure you mentioned, we can cover.
Now, when you say vascular, you mean that's the veins?
Correct.
The circulatory system.
When there's a blockage in the circulatory system, if it's inside a heart, a cardiologist deals with it. If it's a major block that the cardiologist cannot fix, the patient may need an open heart surgery, and we have that facility. Then, if it's in your arms or legs, and the same, it's blocked off, and you're in the risk of losing your arm or a leg because of that, we can still help you. We have Dr. Porter and Dr. Dunning. Both of them highly experienced and very good at what they do. And again, all of these things that we offer patients. So basically, if you're in this community and you come to this hospital, we cover all of these things. You don't. It's not like we just do this and then we have to ship you out for this piece. We cover all of this. And the cool thing, like you were mentioning earlier, is that all of these things, all these practitioners use state-of-the-art technology. So if you go to somebody who's not practicing state-of-the-art medicine, they tend to make big cuts, like you're used to. You know, if you go back 5-10 years, you'll find that patients who needed open heart had their things
they have the tie right there.
Right, right. And or if you did vascular thoracic surgery, there's a big cut. All these people, for example, thoracic surgery, they make a cut only this big. Wow. And he's able to take care of the lung from there, or take out part of the lung, or do what he needs to do.
They try to be as minimally invasive as possible.
Correct, because they're using latest techniques.
Wow.
So the cutting is minimal, recovery is faster, and then coverage is great.
That's cool. So you kind of help oversee all these departments and help bring this technology to them. And you had mentioned earlier that it's administration that really helped attract you to come to Kingman to help set this apart.
To be honest, when I was told that Kingman wants to work with me, I didn't know Kingman, and when I looked it up, I thought, small rural hospital, so that was the thought in my head. I was not expecting anything great, or I was thinking it's a small place, But when I came, I was really surprised. Here's why I think Kingman stands out clearly above any hospital in its class in Arizona, or for that matter, in some ways across the country. The average tenure of a CEO in America is about 3.7 years. So if you look around, you'll find that within 3.7 years, roughly, that's the average. Yeah. Most places have a turnover. They have a new person in charge of the thing. Our CNO, Brian Turney, has been, CEO, Brian Turney, has been in place for 20 years. What does that tell somebody like me who's looking from the outside?
It tells you have strong leadership.
It tells me that it's rock solid. This hospital performs well. So that itself was surprising to me. Then when I looked around, there's Kim Miyake, who's our CNO. There's Tim Blanchard, who's our CFO. There's Ryan Kennedy, who's our CEO. All of them have solid stability, tenure, and performance. So it's unusual to find a group of people like that is so solid, that has great performance, which lends the entire organization a lot of stability.
It's the trickle-down effect,
and support.
Absolutely.
Right. Because if the heads change out, then the entire structure changes out, the entire support system changes out. So I was very pleasantly surprised. And then when I started working with them, unlike any other big hospitals where there's red tape, bureaucracy, these people are really here to make sure that the community gets what it needs, and that we are able to provide the care they need by listening to us, which is so refreshing. So if you have something valid to say, they are there to listen, and then they'll act, which is extremely different from other hospitals where there's a lot of bureaucratic structure.
Absolutely.
In fact, most of the time you don't need an appointment or anything. You can just walk in and meet these people, discuss things, and they will listen genuinely, and if you're making sense, they will act on it. So this is one of the reasons. The other is patient-wise. If I was a patient in the community, why would I be proud of Kingman, my hospital? Here's why. The gold standard for critical care services in any part of the country is that it is covered by what are known as intensivists. These are people who are specialized, board certified, to take care of critical care patients. So you could be a pulmonologist, anesthesiologist, but if you studied for it, passed a board exam to specialize in critical care, then you're termed an intensivist. So the gold standard is intensivists covering every patient in the ICU 24/7. Now, the problem is there are not that many intensivists. So even if a hospital is able to afford them, they may not get enough to cover 24/7. And the other problem is they're expensive. So smaller hospitals that cannot afford it, again, have a problem in covering. But that is the gold standard. That is found to give the best results for the patient. I was absolutely surprised to know that Kingman Regional Medical Center has intensivist coverage 24/7 for all their intensive care units.
It's pretty cool. We can kind of buck the trend of small community hospitals and have the state-of-the-art stuff. Bhratta, I appreciate you coming on the show today to talk to us about everything. It's been pretty educational to learn about all the technology. about all the programs that we do have, and it makes me feel better about living in a community like this that has all the state-of-the-art medical equipment that we need to stay healthy and stay happy. I want to thank you for coming on the show, man. And anytime you want to come on and talk about something, we're more than happy to have you. I mean, you've got a lot of great information, so thank you. We appreciate it. So
thanks a lot.
Thanks, guys, for watching here on Your Health Matters. I'm Scott Kern. We'll see you next time.